Today we're joined by Dr. Michael Yapko, who's presenting on experiential approaches to treating depression. Thank you so much for joining us today to learn more about your upcoming institute.
Thanks, my pleasure.
Tell us a little bit about why this topic is important to you.
Well, there are several thousand reasons why, but the big reason is that depression is increasing in every age group. It's increasing in prevalence around the world. We have unfortunately been so misled into medicalizing what is largely a social problem. And what I want to do is draw people's attention to the fact that this problem is far more social than anything else. When you have a problem that is of this magnitude, that is so devastating to individual lives, you can't help but want to do something, and that's really what I've dedicated my professional life to doing.
So tell me how you became an expert in this area.
Well, I think you're probably in clinical practice for about 4 minutes before you see your first depressed person. Depression is so ubiquitous, and even when depression isn't the primary problem, it's usually a secondary problem since most people don't feel very good about the problems that they have. And when I first started my clinical training, which was back in 1836, there was really nothing known about depression. There weren't any good psychotherapies. There weren't any good medications. Cognitive therapy was in its infancy, and people basically just sat around talking about the past and talking about their feelings and all the things that it turns out are really not the most effective ways of treating depression. And I wanted to find out what could work better, and I've pretty much spent my professional life researching and writing about and developing more active and strategic approaches to treatment that have become the mainstream approach to treatment. And the experiential side of it is that, just giving people information isn't enough. People need to, and do in fact, learn best experientially. And so bringing in more experiential processes like hypnosis and mindfulness and other kinds of things is really a vital part of effective treatment.
You have such an upbeat and hopeful style with that experiential element that you were just mentioning, and I do think that makes your work in this area somewhat unique. How did you come to really bring that element to this topic?
I love seeing change happen, and I love seeing change happen quickly. And the thing about treating depression is it is something that can resolve readily. It is something that can resolve pretty quickly. So I'm optimistic about that based on 30-odd years of clinical experience that shows me that when people are pointed in the right direction, a lot of really good things happen really quickly. And, how can you not enjoy that process, and how can you not feel good about the fact that you can make that substantial a difference in people's lives on a relatively short-term basis?
Absolutely. That's very inspiring.
To me, it's really important to pump marriage and family therapists right up again and say to them, there is nobody that can do what you can do.
That's what I want to hear, absolutely. So what are you looking forward to most about offering this institute? Is it the location in Asheville, the group of people, the topic?
The enthusiasm is contagious. There are a lot of laughs. People have a great time while we're talking about really serious stuff. And it's very reinforcing on all sides. I enjoy the interactions. They learn a lot, and I learn a lot being with them, and it really works well.
Thank you for joining us for this interview. If you're interested in learning more about the AAMFT Institutes for Advanced Clinical Training in 2012 in Asheville, North Carolina, be sure to check out all the information at www.aamft.org.